medical aspect of ano. So that depends on the program. Okay? So, yes, ano ba ang sasagutin ko rito? Lahat. Please describe your field of work and special. I'm a neurosurgeon. We treat anything surgical which is in the brain and spinal cord or in the spine or any spine problem or brain problem that needs surgical attention. Okay, whether it's a tumor, whether it's blood, because of stroke, because of aneurysm, yung mga example, or if it's trauma-related, yung mga nabunggo, nabarel, nasabugan. So yun, of the central nervous system, which is the brain and the spinal cord. Okay. Next, okay na ba? Should I read on it? Or?
Jerry, ikaw na ba?
I should read po.
Okay.
The second
Ikaw ang camera woman lang.
Apo.
Okay. Dali naman ang trabaho.
So my next question po, what do you do in your, what is your role as a neurosurgeon?
Well, we take out, if we need to take out, we should take out the pathology, meaning the lesion, we take it out. For example, you have blood collection sa utak, and then you take it out. Or if there's tumor, we take it out, or we repair. What do we repair? Like, kunyari, spine problem. Naglalagay kami ng bakal, etc. So, it's taking out and probably repairing. Okay? Whatever the pathology is.
So the next question, what are the usual cases you've been handling?
A lot. Sa brain, most of them, incidence-wise, ibig sabihin incidence kung ano yung mas madalas, would be stroke patients. Again, ano ba yung stroke patients? Stroke patients are either there's hemorrhage or may nagbarang ugat. Okay? Yung hemorrhage, that's the one that we take out. Tinatanggal namin yung dugo na kumalat. But not all dugo are being taken out pag malalaki lang. Okay? Or infarct. Infarct, nagbarang ugat naman yun. We don't do anything there. That's the most common, stroke patients. Next would be trauma. Nagmumotorsiklo, na-aksidente, nabasag yung bungo. Okay, we repair that. Or may dugo sa utak, we take that out also. Yung mga ganon. So, stroke, trauma, tumor, okay, may mga malignancy or tumor enlargement sa utak or spinal cord, we take that out. Okay? Ano po ba yung most common? Sa bata, most common still is hydrocephalus. Yung lumalaki yung ulo. Okay? So we put in a shunt there. What else? Sa spinal cord, there could be tumor, also fractures of the spine, and disc herniation. Yung mga basta disc herniation. Ayun, basta ganun, disc. This is your back. Ayun yung disc herniation na tinatawag. Okay? This is your back. That's your spinal cord there. So, ayun yung disc herniation, may umiikot dito. What else? Aneurysms. I guess aneurysms is very common. Oh, you hear that in the TV. Diba? Sila Isabel Granal. I don't know if you know them. Basta ayun yung mga famous na Fernando Po Jr. Those are aneurysms. We take care of that also.
Okay, thank you. So, what do you think is the significance of neuroscience in the field of medicine?
That's difficult, but definitely it significance. If you think that your brain is important, then neuroscience is very important. Your spinal cord is important for your movement, and definitely neuroscience is very important. Okay, so well, significance, I think I don't have a direct answer to that. Okay, but sa akin is how to be harmonious with the rest of the specialization. Kasi neuroscience naman is not a standalone. Kaya nga sabi ko sa'yo, neuroscience, it's not just the neurologist and the neurosurgeon. We collaborate with rehabilitation, rehab medicine, yung mga PT. We collaborate with cardiologists, we collaborate with radiation oncologists, etc., etc. So I don't want to focus on neuroscience, but you know, it's more of collaborating with other specialties.
What do you think are the contributions of neuroscience to society?
Same answer.
Same answer.
Yeah. It's again with the same as with other specializations. We can treat, we can repair patients with and so we can prolong their life. Okay, so if we treat them, we make them happy, we make the relatives happy. Okay, so yeah.
What are the devices or technology you use in your field of specialization?
In neurosurgery, I'm talking about surgery mismo, there are actually a lot. No? In the operating room, we have different gadgets which is hard to explain. No? Like the microscope, not the microscope that we use in the laboratory, etc. These are big microscopes so that we magnify it 400 times. Okay, so just try to imagine a small dot like this will probably this big during surgery. Okay, so that's probably 400 to 600 times magnification. So it's very important if you want, if you're operating on the brain and you can't see, but using a microscope, it's a lot. It's easier, okay, and for safety wise. Maraming mga ano eh. And one important also is probably radiation. Okay, some of you will probably hear that laser. It's not actually a laser, but it's radiation. It's one of the ally that we use na yung mga ayaw magpa-opera. If they're amenable, then we can just do laser surgery or radiation. Okay, so yung ibang tumor, sometimes they don't need surgery anymore. We can use that. Medyo technical yung iba. I don't know if it's going to be aneurysm. It used to be just surgery, like we put clip sa aneurysm, kasi aneurysm parang dumobo. Nowadays, there are non-surgical procedures like they put in a small wire, we call it endovascular coiling. We put in a small wire, tapos yung aneurysm, babarahan lang nila ng maliliit na wire. So that's not surgery. Okay? What else? Yung iba mga mga instruments na which is technical.
So, since po yung topic po namin and yung course po namin is Science, Technology, and Society, so mas related na po dun yung questions po namin next. So, what is the impact and role of technology in the field of neuroscience?
Oh, big. It makes everything safer, more effective, and not necessarily cheaper, okay? But it's, and easier for the operators, coming operators. So, yun. Ano ba yung sabi ko? Easier, safer, more effective, etc. Very important. Just give you an example. Probably 20 years, 30 years ago, surgery is being done for 12 hours. Simple case of surgery. Okay, nowadays, 2-3 hours. Okay, and it makes everything safer. Okay, dati inooperahan ng gising ang pasyente. Okay, pinainom lang ng alak. You see that, because that's true. Okay, siguro mga medieval period, painumin lang ng alak and then ooperahan. But now, because of the technology, because of that, it's safer for the patient, and it's faster and it's simpler, etc.
For our last question, what are your expectations for the future of technology and neuroscience?
If there's going to be too much technology, you will not be needing our services. So, mas maganda nga actually. Okay. Technology-wise, I think marami with regards to, we call it minimally invasive. Minimally invasive meaning there's less incision, less hospitalization period for the patient. Ibig sabihin, parang imbis na ganito kaliliit, nagiging maliliit na. Okay? Yung mga nakikita nyo, yung robotics, etc. that's being used now in medicine, etc. In neurosurgery, there's also customization and yung minimal invasive procedures na ano. So, it's still vague, but mostly they will still, neurosurgery will be still mechanical. Ibig sabihin, kailangan pa rin ng human intervention, etc. But yes, but we're trending more on the so-called minimally invasive surgery. Okay. Other than that, marami pang mga robotics.
Okay na? Yes po, that's all.
Pag makapal ba talaga yung salamin, ibig sabihin mas matalino?